I think the first step is having conversations like this one and making sure people are aware of the ability to have options outside of simply going to the pharmacy and filling that exact prescription.
Hi, everyone, and welcome to Hi-Fi Health News. I'm Erika Grotto. Prescription drug prices in the United States are among the highest in the world, with hundreds of billions of dollars being spent every year. Individually, about 1 in 4 patients report difficulty paying for their prescriptions. But there are things you can do to make the burden a little bit less. Joining me today is Dr. Ruchi Talwar from Vanderbilt University Medical Center. Most of us know about things you can do at the pharmacy to save a little money, like asking for a generic instead of a name brand. Are there other things you can do kind of when you're standing there at the window?
Yeah, I think a lot of patients don't realize that some pharmacies may have coupons that they can ask for. There's a company out there called GoodRx that actually works with many local pharmacies to provide coupons for certain common drugs. So I think it's always worth an ask.
So I've seen the GoodRx cards. I've actually used them before. Is there a way to check before you go to see if you can get a discount on something?
Yeah, I think the best way to stay ahead of potential discounts, particularly as it relates to GoodRx, is first checking the website. You can always log on and see what's available. But more importantly, bring up that conversation with your provider in the office. I really encourage patients to have an open dialogue about maybe samples that providers may keep in the office, GoodRx coupons providers may have already looked into or have stashed. But beyond that, I think a conversation with the provider might also shed light on some online tools that could be available to get your prescriptions at a lower cost.
Yeah, all good tips and certainly things that I've experienced before of, we want to try this prescription. Hey, we've got some samples. Use those before you fill it. Then you don't have to pay anything, that kind of thing. So,
Yeah.
And providers, in my experience, tend to be pretty on top of those things because they know, especially with the pricier drugs.
Yeah, that's right. And speaking from clinical experience, I think, my number one goal is to make sure that we're achieving good outcomes here. And so that means the patient has to be able to afford their medication. So I am totally aligned and on board with spending a little bit of time with my patients to make sure that we're getting the drug to them in a way that is cost effective. So if that means thinking about an online pharmacy program like Mark Cuban Cost Plus Drugs or Amazon Pharmacy, I'm willing to spend a few minutes exploring some of those options. It's really important to me that not only am I prescribing the right drugs, but the right drugs are actually being used.
Yeah, so let's talk about some of those other places because you don't have to go to your local, CVS or grocery store pharmacy or Walgreens or whatever you have near you. Those are certainly great options if you need them, but there are online pharmacies now. How should you go about price shopping for your medications if you have a lot of different options?
Yeah, it depends on how you're paying for the drug. And what I mean by that is people get their drug coverage through a variety of different means. A lot of patients who are 65 or older may be using Medicare. And Medicare Part D plans, although they're through the Medicare program, they're actually administered by private companies. And there is a new tool that Medicare has introduced called the Medicare Part D Plan Finder that you can find online in the Medicare website. That plan actually allows you, that finder, I should say, that finder tool allows you to select a plan that would have low copays for some of your most expensive drugs. So that's one place to start. I spend time talking about that because a lot of Medicare patients don't realize that different plans have different copays for different drugs. Another way to price shop for people who may be paying copays through employer-sponsored insurance or insurance that they receive in another format is by looking to see if it's actually cheaper believe it or not, to pay out of pocket and forego your insurance completely. That's when some of these online tools become really handy. So I talked about Mark Cuban's Cost Plus Drugs. That online pharmacy does not accept insurance. And you're able to go and check the price of that prescription if you were to pay directly. Believe it or not, a lot of times it is a lot cheaper, particularly for low-cost generics, to just pay out of pocket. And so you can call your pharmacy and say, hey, listen, here's my information, here's my insurance. How much would it be to fill my statin medication? And then you can compare that directly with Cost Plus Drugs. Amazon Pharmacy, in some respects, is starting to accept insurance benefits. There's some nuances there, but if you go online on Amazon Pharmacy, you can check the price of the drug similarly. In some cases, you may be able to use your insurance benefit, in some cases not. But exploring those online tools is a great place to start. From the provider lens, there are some tools available at the point of prescribing to see if the drug would be covered and what your out-of-pocket costs would be. So that's the burden I put for any providers who may be tuning into this. We have the ability to do that in some cases too, and it's important that we pay attention to those data pieces when we're talking to the patient or actually prescribing the drug in the electronic medical record.
So this is going to sound like a complicated math problem here, a little bit, but something else I think that's important to point out is if you go outside of your insurance, nothing you pay is counting toward your out-of-pocket maximum, your deductibles, whatever. So you also kind of, if you have maybe long-term prescriptions that you take all the time, you need to weigh your per refill cost, right?
Yes.
Whatever you want to call that, with your total for the year, and you might actually hit your out-of-pocket maximum at some point, and it's less over time.
Yes.
So that's a lot of math, but it's important to do it.
It's a super important point. I'm glad you brought it up. And you're right. This is a lot more complicated than I think many of us would want it to be. But I think the first step is having conversations like this one and making sure people are aware of the ability to have options outside of simply going to the pharmacy and filling that exact prescription. I think it can be really difficult to have some of these conversations with your provider in the office. It feels like there's some stigma attached to it. I recognize that, but I really encourage all of the patients who might be tuning into this to be honest, to be open, because I promise you that your providers want to work with you to find solutions to make sure that you're achieving your best health outcomes. So if you find yourself in that situation where you're trying to figure out what is cheaper, is it cheaper for me to go through my benefit? Should I forgo my benefit? Should I check one of these pharmacies? I really encourage you to consider talking to your provider. They may have some insight there, or even more importantly, they may be able to link you up with potentially a financial counselor who could help through either the health system or the office. And so there are options there, and there are resources available.
Yeah, I've noticed too, when I do go to my neighborhood pharmacy, if I have questions about things, or sometimes they even anticipate, like, this prescription is really expensive. Do you want to do this or that? And they're the ones who are dispensing these medications. They're the ones who are dealing with the patients all the time. And they know whether someone is going to say that's too expensive and walk away or not, where the provider might not be privy to that right away.
Absolutely. Absolutely. And I think that's a great point, in that your pharmacist is also a resource. So they can potentially reach out to the provider office if there's an issue, if there's a concern at the time of the fill where the price is just too much. So be aware of that and use your local pharmacist and your pharmacy as a resource in addition to your provider.
There are probably people out there who have not used a mail order pharmacy before, maybe feel more comfortable going to the place on the corner, even if it costs a little more. And when you and I met at HFMA's annual conference in Denver, we talked about how some of those places, like your mail order pharmacy, might be great for certain types of things where your local one might be better for something else. Can you talk a little bit more about that? Like, walk me through the medicine cabinet, right? Tell me a little bit about what you want to get from each place.
Yeah. I think the nice way to think about this is medications that you may be on long term that you may not need to pick up this week. And so if you're thinking about that sort of a medication where you have enough to get you through the next week, it's a long-term refill and you want to automate it, then things like online pharmacies make a whole lot of sense. However, if you have an acute need, and so what I mean by that is an infection, an illness, or you had a procedure and you need medication related to that procedure, whether it's an antibiotic or pain medication. Those types of medications, there is an immediate need for, and waiting that week that it may take for the online pharmacy to fulfill that order could be potentially harmful. So in those cases, I think that the local pharmacy has a very important role to play. But remember, that's a perfect time to consider coupons like GoodRx, because you're able to take those coupons and redeem them at your local pharmacy.
That's it for us today. I'm Erika Grotto for Hi-Fi Health News. Thanks for watching.